Hi, my name is Aaron. I'm a second year nursing student from UBCO, and I'll be performing medication administration today. So the patient that I'm caring for today is Colin Sharp. Her allergies are NSAIDs and flowers. So the medication that I'll be giving to her today is metoprolol. It's a high alert medication, an antihypertensive medication used to treat or manage high blood pressure, which is hypertension, used to prevent myocardial infarction and angina. So beforehand, I already did a head-to-toe assessment and did her vital signs, which is good. So her vital signs are heart rate is 78 beats per minute. Her oxygen saturation is 96% on room air temperature, and her respiratory rate is 16 beats per minute. Her blood pressure is 133/91, and her temperature is 36.9. And the reason I'm giving her metoprolol, 100 milligrams PO, because to treat her chronic hypertension, basically. So after reviewing the assessment and the MAR, we're ready to go to the OMSA. So when we're grabbing today's metoprolol 100 milligrams PO, which is basically this one. Oh. Okay, so after grabbing the med, we have to perform a medication check number 1. So we have to check the patient, sharp Colin, allergies, NSAIDs, flowers. This checks out. Medication is metoprolol, and medication on the package is also metoprolol, which checks out. The dose is 100 milligram. It's also 100 milligram for the MAR. PO, which is by mouth, and which checks out because it's a tablet. The time, we're going to be administering at 9 a.m. sharp, so it's currently 8:55, so we're right on time. It is supplied as a 100 milligram tablet, which is it is a 100 milligram tablet. So after performing medication check number 1, we are ready to go to the preparation table. Actually, we don't do that. So first thing, totally forgot. You need a cup for the medication and a cup of water for the patient to drink. So at the preparation table, you don't have to do anything because it's not a liquid medication. The only thing we can do is perform another medication check. So basically, we got sharp Colin. Date of birth is 2/23/1984. Her allergies are NSAIDs and flowers, which checks out. Metoprolol, 100 milligrams PO. Metoprolol, 100 milligrams PO, and it's a tablet, which means that we're going to be administering it by mouth. It is supplied as a 100 milligram tablet. Of course, we have a tablet, and the time is 9 a.m. to administer, and it's 8:58, so we're right on time to administer that. After performing the second medication check, we have to dot the MAR to basically show that we've done our medication check. So boom. So we grab our pen, medication, cups, and go to the bedside. Okay, so outside the bedroom, you have to do hand hygiene, some gloves. So we knock your MAR. Okay, so knock. Hi, Colin, good morning. My name is Aaron. I'm a second year nursing student from UBCO, and I'll be administering your AM meds today. So can you tell me your full name?
Colin Sharp.
Okay. Can I see your wristband? Do you know your date of birth?
2/23/1984.
Okay. Do you have any allergies, Colin?
NSAIDs and flowers.
Okay. So by checking the wristband, you basically check out that we have the right patient because she said her name, date of birth, and her allergies, which checks out with the MAR. Next thing we need to do is our last medication check. So we have to check the medication, patient, time and dosage and route. So Shark Collin, her date of birth is 2/23/1984, and her allergies are insects and flowers, which we really verified with the ID and also talked to her. The metropol, the medication we're giving is metropol, 100 milligrams of PO daily, and it's supplied as a 100 milligram tablet. So basically, you got inside metropol, the right medication, 100 milligram right dose. It's a tablet, supplied as a 100 milligram tablet, which is PO, which checks out the route. And currently the time is 9 a.m., so we're just right on time to be giving the medication. So after the medication check, we are ready to prepare the medication. Okay. So calling him back. So the medication that I'm giving you today is metropolol, which is basically an antihypertensive medication, basically to treat your current hypertension, to prevent like heart attacks and chest pain. So I'm giving you a 100 milligram dosage because it's the recommended dose for your severity of your hypertension. And the side effects you might get is dizziness, lightheadedness. You might feel cold, and your arms and feet might feel cold. If you experience any shortness of breath or chest pain or wheezing, just let us know. Then after I give you this medication, I'm going to be just coming back every 5 to 10 minutes just to assess and monitor your heart rate, blood pressure, and ECG, and also just check for like signs and symptoms of heart failure and anginal attacks. So also as I explained to you, the dizziness, so just make sure you're moving very slowly when you're changing around positions in your bed or going to the bathroom, because the medication can suddenly drop your blood pressure, which can cause you to become dizzy. Do you have any questions?
No, thank you.
Okay, so here you go. Okay. Thank you, Colleen. Okay. So after giving the medication, we noticed that we watched her took the medication, so we had assigned them now. So we put our initial AN, UBCL SN2, and that's about it. We can take off our gloves and perform hand hygiene, which basically checks out the medication administration.